Grand Valley, covering stories that matter. This is Action 4 News at 6.
12 days left for you to get covered. Tonight we discuss why you should sign up and how the uninsured now have health care options, including women. The phone number to our special hotline number is 362-4U. Good evening, I'm Ryan Wolf.
And I'm Marcy Martinez. Again, that number 362-4968. The Affordable Care Act and you. Action 4 News making sure you get signed up for the very important deadline, March 31st.
That's right. We are taking your questions. We have a panel of experts here to really answer all kinds of questions. We're also on social media. You can find us on Facebook. You can find us on Twitter. There are lots of ways to get your questions answered. And we do want to remind you that if you get a busy signal, keep trying that number, 362-4U. We promise we will make sure to get your questions answered, even if we have to stay a little later, right?
That's right. We do have a lot of experts answering the phone here. You're going to hear from them in just a bit. We have Driscoll Health Plan. We want to thank Doctors Hospital Renaissance for hosting us again this year. We did this a few months ago, but now again the deadline is looming. We are going to have navigators who have actually been signing people up the last few months in a hurry to make sure we reach this deadline. They're going to tell you what you need to know and what you need to bring to their office. Even a workshop going on tomorrow with the Congressman's office, Rubén Hinojosa, that we're going to tell you all about. Again, all this information very important for you to know. That's why Action 4 is taking action for you.
Less than 2 weeks away, folks. That March 31st deadline is creeping up fast. So 362-4U. I want you to take a look at some of the statistics we have right now. Take a look at this. More than 219,000 people in the McAllen, Edinburgh, and Mission areas do not have health insurance. Again, 219,000 people in the McAllen, Edinburgh area do not have health insurance. In Brownsville and Harlingen, the number is nearly 110,000, and this doesn't even include Willacy and Starr counties. Joining me right now, Sylvia Garcia traveled from Dallas. She's with HHS, and she's here to answer some questions as well. She works with the Centers for Medicare and Medicaid Services. Thanks for joining us, Sylvia. Great to have you.
Yeah, I'm glad to be here.
We appreciate it. We talk about the marketplace all across portions of the state. Why should people care about it?
Well, this gives you peace of mind because health insurance is the key resource to have. If something ever was to happen to you, you have that kind of backup and having some kind of health care coverage.
It can be intimidating because people don't really know what to expect. Is it an intimidating process like some people think?
Not at all. You've got great navigators here who will walk you through the process. The 1-800 number is available as well, and including the website at healthcare.gov. But really, you just need to understand how health insurance works.
Biggest misconception that you think people are having so far? You've traveled all across the state. Is it the same misconceptions?
Basically, especially in the Rio Grande Valley, a lot of people are concerned about what do I need for health care coverage? What documentation do I need to have to allow me to qualify to be a part of the marketplace?
We have the experts in hand. Sylvia is one of them. Now let's toss it over to Marcy.
Well, all of our phones here are busy, but keep calling in. That means a lot of you have questions. We understand. That's why Action 4 is doing this for you before that March 31st deadline, that is. They're not 34 days in the month, 31st deadline. And again, you have to get signed up. That's why we are here to help you out. And one of the organizations, Enroll America, which I'm sure you've heard a lot about, Action 4 has done many stories, getting you the facts about health insurance. Jose Medrano, you have been interviewing with us since this all started, and you've been connecting the community to their resources. What do they need to know now?
Right. Thank you, Marcy. We've been educating, engaging, and enrolling the community. What we need for them to know now is to call in if they have any last-minute questions. There are 12 days left. As has been said, we've got an event coming up tomorrow and Friday at the McAllen Conference Center, and we're inviting folks to come out. 12 days left.
Okay, now Jose, because you've worked with a lot of the organizations and again connecting the community to get enrolled, what is the biggest question you think comes from people, even in colonias here in the Valley? We have a lot of those people. I know you've reached out to them. They're scared to sign up for this insurance.
Well, a lot of them are scared maybe because they're not familiar with the process, and it's a very easy process. Language is very easy. Our counselors and navigators speak English and Spanish, and so they'll be able to help whether they come in person, whether they get on the 800 number, or whether they get on the website. So it's a very easy process. We're just encouraging the folks to come in. 12 days left.
All right. Again, that deadline, March 31st, everyone. Jose Medrano with Enroll America. Thank you so much. Let's go on over to Ryan now.
Marcy, thank you so much. I'm here with my friend Israel Rocha, CEO of Doctors Hospital Renaissance. First, thanks for hosting this tonight.
Sure, no problem. Thank you. It's our pleasure to be here.
And this is our second time being here for such an important topic. Tell us again why you wanted to partner up.
You know, I think that it's coming from an area where we have a lot of uninsured and lead the country in the uninsured. We really wanted to make sure that everybody had this opportunity to enroll, get the information they need to get insurance and get covered.
When it comes to the Affordable Care Act, talk to us. Why do you think that it's so important that people pay attention to this deadline?
I think it's important because you don't want to miss an opportunity to get your loved ones insured and to take advantage of a program that helps you get the health care services that you need.
Israel Rocha, thank you so much. A beautiful facility here today. We're in Edinburgh at Doctors Hospital Renaissance. Also here today are Sergio Chapa, who's manning the social media desk because we're taking questions on Facebook and Twitter. Sergio.
That's right, Ryan. We're right here at the Affordable Care Act social media hub. Myself and Elizabeth Espinosa. Elizabeth is answering questions from Twitter. I'm right here on Facebook. Elizabeth, what are some of the questions you're receiving online?
Well, basically, they're asking us how much is the Affordable Care Act, and it also depends on how much you make and the premium. So that's something people definitely need to keep in mind when they're looking into the Affordable Care Act.
Right, definitely. Now, also one of the things here, we wanted to say that all lines of communication are open tonight here. We've got the phone lines open, but we're here on Facebook, we're on Twitter, we're on Instagram. We're here to answer all your questions about the Affordable Care Act right here and right now.
All right, well, we have Dr. Riaz Sharif with Driscoll Health Plan with us. We've been talking about young adults. What about the children, doctor? And how does this law affect them?
Well, there's going to be increased coverage for children because of the increase in federal poverty level from 100 to 133%. This increase in federal poverty level will allow for more children to be covered under Medicaid. What this also means is that some of the children who qualified for CHIP will now actually be eligible for Medicaid. Okay. So it's a very good thing.
Well, that's what I was going to ask you. What should a parent do if they feel their child is eligible for Medicare? Who do they need to talk to?
Well, they have multiple options available. They can go to chipmedicaid.org or yourtexasbenefits.com, or very simple, they can call 211 from their home phone and select the language and then press 2. It's very simple. And also they can contact local community navigators, or they can call here right now.
Perfect. You can call here right now. Again, our operators, our experts are on the line, but we're going to have more for you right here. Keep calling, right, Ryan?
That's right, Marcy, and I'll tell you what, take a look behind me. These people have been answering the phones. It's been nonstop, really, since 5 o'clock when we started this. So if you're calling and you have a question, you don't get through right away, don't worry. Keep calling. We promise to stay here as late as possible so that you're covered before the March 31st deadline. Stay with us. Our special edition of Action 4 News at 6, the Affordable Care Act deadline, continues right after this.